if a patient has PCD, has the syndrome, and the killer T cells are attacking the cerebellum, what is happening inside the cerebellum at that time?
So paraneoplastic cerebellar degeneration, it's a very refractory and challenging condition to manage. And as you rightly pointed out, even though there are blood biomarkers in the form of antibodies are not doing a lot in that scenario. We don't think antibodies are pathogenic or causing damage to the cerebellum. Many of the experts in the field, as well as some of the experimental data, suggests that it's the T cells attacking the same protein as anti-Yo, which is entering the cerebellum and causing destructions of the neurons in the cerebellum, such as the Purkinje cell, which makes it extremely important for us to diagnose these patients really early. And this is what differentiates the killer T cell mediated syndromes from antibody mediated syndromes, because antibody mediated syndromes act by causing neuronal dysfunction, and once you potentially remove the antibody, there's a chance of neurons to recover. But the T cell mediated syndromes just wipe out the neurons. And as our brain doesn't have a capacity to grow many neurons to replace the ones which were damaged, it sometimes through neuroplasticity allows neurons which are not damaged to take over the function of the neurons which were. But given the extent of damage we see in patients with paraneoplastic degeneration, even that doesn't happen to a great extent. So recognizing and understanding and identifying these patients early, treating the underlying cancer, and suppressing or curbing the immune system so this T cell attack can be halted at an early stage is very important.